Today we are going to talk about the endometriosis, but the main purpose of this video is not the definition and the side and symptoms of the endometriosis, but today the main focus is on the infertility that we can see in case of endometriosis. So we will discuss that what are the causes that can leads to infertility in case of endometriosis. So first of all, let's go for the definition of the endometriosis. So endometriosis, we can say it is a condition in which the cells similar to those in the endometrium, the layer of tissue that normally covers the inside of the uterus, grows outside the uterus. So we can say that endometriosis is a condition where we can find ectopic endometrial lining outside the uterus. Normally we can see that this is the uterus, and the uterus, the innermost lining of the uterus is what we call as the endometrium. It is the columnar epithelial lining, so it is the endometrium. So if you find that these endometrial epithelial cells, they are also found in areas outside the uterus, then we can say that this is a case of endometriosis. Okay, so it is what is the pathophysiology and what is the cause that why the cells or why the inner lining of the endometrium can see outside the uterus? Because of the retrograde menstruation, or we can say that a regurgitation of the menstruation, or regurgitation of the menstruation, or retrograde flow of the menstruation. So if you study about the phenomenon and mechanism of the menstruation, we can say that whenever during menstruation, these endometrial lining, they become thick, and once the cycle complete, there is a shedding of this endometrial lining. So the gush of blood will flow outside the uterus, comes out. So a new layer of endometrium can form in a respective or the next menstruation cycle. So sometime what happen, the flow become reversed. There is a retrograde flow of the menstruation, or as well as there is antegrade and retrograde, or only retrograde, or whatever. So you just need to remember that in endometriosis, the main pathophysiology is that the retrograde flow of the menstruation. So it may go to the fallopian tube, and from the fallopian tube it may stuck to the ovary, or may enter into the peritoneum. So all these places, they are what we call as the ectopic place other than that of the uterus. So once you can find some sort of endometrial tissue here, it is what we call as the endometriosis. So what are the areas or the common site where we can see endometriosis? So the most common site is the pelvic region, where the ovaries are the most common site, where we can see chocolate cyst, cul-de-sac, or we can also say the pouch of Douglas, uterosacral ligament, posterior surface of the uterus, posterior broad ligament, rectovaginal septum, tubes, and around the round ligament. So there will be the deposition of the endometrial lining. What are the extra pelvic sites? It can also found in intestine, in the lungs, thorax, even in eyes. And the less common site, they are the cervix, because it is antegrade flow. Okay, when there will be antegrade and there is a deposition of this in the cervical mucosa or in the cervical region, so it's a less common area. Hernial sacs, umbilicus. And what are the symptoms that we can see in a case of endometriosis? Symptoms: there may be dysmenorrhea, pain during menstruation; dyspareunia, pain during intercourse; infertility, pelvic pain, abdominal cramps, diarrhea, and constipation. So these are some symptoms, but the main symptoms that you usually can see, that they are dysmenorrhea, dyspareunia, and infertility and pain. So today we will talk only about the causes of infertility in endometriosis with a great detail, or some causes we can see. So here is the presentation, and if you wanna know, so these are the ectopic or endometrial linings. So in the ovary it is called chocolate cyst, is endometriosis. Here we can find in the fallopian tube, here on the top of the fundus, this is what the endometrial lining, endometrium, and this is the uterus. So let's go to the main topic of today's discussion. Okay, so infertility in endometriosis. So what are the possible mechanisms? There is a four main mechanisms. Number first, mechanical causes. Number second, alteration in peritoneal fluid, alteration of systemic immune response, and hormonal factors. So one by one we will see that what are the components of each mechanism. Okay, so in case of mechanical causes, what happen? There will be altered tubo-ovarian relationship. So for example, this is what the ovary, and this is the fimbria, and this is the fallopian tube. So if there is adhesion because of long-standing endometriosis, for example, in this area we can find endometriosis, or here there is a formation of adhesion between the endometriosis particle with the surrounding tissues. So because of the formation of adhesion, the normal relationship between the fallopian tube and the ovary become disturbed. Now we can see that ovary is here because of adhesion with something here, and fallopian tube is oriented upward or something like that. So we can see there is no good relationship for the ovulation. So the ovulation will not occur. The ovulation go to the peritoneum. Okay, so there is no effective ovulation. So because of that, we can say that infertility can see in case of endometriosis. Okay, and another point is altered tubal mortality. So it's again the same. When there is a formation of endometriosis into the fallopian tube, there is a formation of what we can say adhesion. There will be bleeding or something that can affect the motility of the tube. So once there will be the failure of motility, then we can say that there is no effective movement of the egg or the zygote if formed, okay, or the embryo, like that. Okay, so another point is impaired oocyte pickup. As I said, if the fallopian tube is not effectively working because of adhesion, because of something, the fimbria that get stuck with the surrounding areas because of adhesion, so there is no effective movement of the fimbria. So because of that, there is impaired oocyte pickup. So alteration in peritoneal fluid. So why alteration in the peritoneal fluid? Because if the endometriosis is found into the pouch of Douglas, for example, in the peritoneum, this peritoneal endometrial particles, they get engulfed by the macrophages and they get destroyed. So here we can see that there is an inflammatory process going on. So as a result of the inflammatory process, there will be increase in different cytokines, prostaglandins, and that changes the peritoneal fluid consistency or chemical composition. So once the fluid change its consistency, its composition, then it affect the motility of the sperm, the motility of the oocytes, and the interaction between the sperm and the oocyte, because there is a space, and this is what the peritoneal space. So if the fluid get disturbed, it definitely inhibit or somewhat affect the interaction between the oocyte and the sperm. Okay, so we can see that the macrophages, prostaglandins, cytokines, they affect the sperm motility, sperm oocyte interaction, sperm phagocytosis, implantation failure. So it is not only affecting the motility of the sperm, it is not only affecting the interaction between the sperm and oocyte, it is also disturbing or causing the sperm phagocytosis, and it also disturbing the implantation. Alteration of systemic immune response. So why the alteration is again because we can see that the endometrial cells, they now deposited outside the uterus. It means that any cell, when it go out of its original place, for example, if you try to put a hepatocyte in your brain, definitely it will not survive there. Antibodies will form against that hepatocyte into your brain, and brain cells, phagocytic cells, they start to destroy, and there will be a inflammatory environment will create that not only disturb the hepatocyte, also disturb the neurons. So just like that, in this case, when the endometrial lining start to grow outside the uterus, the body start to form antibodies against that, and that antibodies will rise in the blood vessel in circulation. Now it's also start to attack the endometrial lining, so it can also affect the implantation or the formation of the product of conception. Okay, so increase anti-endometrial antibodies, it is the immune response. Increase cell-mediated gametocide injury. So now the cytotoxic T cells, they start to destroy the endometrial lining and also the gametocytes. So what are the hormonal factors? There will be defective folliculogenesis if the endometriosis is present into the ovary. Okay, here in these areas there is a chocolate cyst will form, and that will disturb the normal folliculogenesis. Follicles will not start to form. So defective folliculogenesis, luteinized unruptured follicle in case of 4 to 35%. Again the same, there will be disturbance into the ovary that not only disturb the folliculogenesis, it also disturb the ovulation process. So luteal phase deficiency, once there will be no folliculogenesis or some follicles are formed but they fail to ovulate, then there is no formation of corpus luteum. Corpus luteum formed as a result of ovulation. Once the egg oocyte from here, it's ovulate, it's go into the fallopian tube, then the remaining part, that the granulosa cells, theca cells, then they form a yellowish structure. That is what corpus luteum. This is responsible for progesterone synthesis. So now there is no folliculogenesis, defective ovulation, so no formation of corpus luteum, or we can say that luteal phase deficiency. Hyperprolactinemia and galacturia because of increased progesterone level that leads to galacturia or rise the level of prolactin. Fertilization and implantation failure, we already said that when there will be hormonal deficiencies, when there will be disturbance into the hormone, we can see that when there will be a high level of estrogen in the circulation because of the endometrial cells, it can suppress the release of FSH and LH. So there is a disturbance into the hormone that affect the fertilization and implantation. So these are some points about infertility in endometriosis.